The Alldus podcast is brought to you by Alldus International, supplying your expert AI and digital transformation staffing needs across the US and Europe. Today, you are listening to our AI in Action series, where leading minds in AI from across the world share their story, success, and advice. AI in Action cuts through the hype and explores the true impact of artificial intelligence in our world today.
You're listening to AI in Action. I'm your host, JP Valentine. Our guest today is Nilanjan Chakravorty. Nilanjan is the Chief Data Officer at EmpiRx Health. Nilanjan, welcome to the show.
JP, thank you for having me here. It's my pleasure.
Yeah, we're delighted to have you. So Nilanjan, we've got a lot to cover today, but let's jump straight into things with yourself as we do with all our guests. Could you give us a bit of an overview of your background in technology and data, from where you got started, maybe some of the roles you've held along the way, and take us up to just as you joined EmpiRx Health?
I've been pretty fortunate in having a very varied career and a journey in IT and technology. Of course, I started as a technologist, came out of college, got a certificate in computer engineering, and quite frankly, my first stint was, would you believe it, in a desktop publishing world, right? And I went to it was my first job out of college. I went into a Yellow Page company. This was back in the days of Calcutta, there. I calculated Yellow Pages. After that, I came to the US. I started in finance, on the finance investment banking side, pursued debt management. In technology, of course, working with different, risk management, product engineering. I'd done finance for, I think, 15 years in New York. And after some time, it struck me, I wasn't learning anything new. I quit finance, I quit investment banking, and I came into healthcare in New Jersey. I lived in New Jersey. I joined a healthcare conglomerate, a conglomerate of multiple hospitals that we managed, insurance, all care. And I came into this healthcare industry brand new, having to start from scratch, learning what when the terms meant. And one of the things in healthcare that I keep hearing are these various acronyms. It was a tough task, but it was a good journey where I was really learning something new that helped me a lot. I really understood how healthcare works and how behind we are in terms of other consumer areas where there is on-demand services available these days. You want to order a pizza, you can do it from your phone. But you want to order your medication or your prescription? Oh, boy, good luck with that.
Yeah.
So I learned some of these challenges, and this is what helped me understand why healthcare is such a complex way, because of the human factor, right? In the startup world, in particular, there have been a lot of tech startups that have tried to get into healthcare these days. And many of these have failed. The primary philosophical reason is because they have assumed that technology is going to solve the problem. But at the end of the day, at the end of your technology stack, there is a human person who has real world health problems, who's suffering from economic situations that they cannot afford the medications. They cannot go to the grocery and make a decision whether they should buy the grocery or buy the medication. It's a choice, either or for them. And that is where the human connection comes in. And that is where tech has generally actually failed. When we use technology as the enabler of healthcare, that it has generally been successful.
Great segue, I think, into talking to you about what you're doing currently with EmpiRx Health. So we're going to go down the solving of this complex problem with EmpiRx Health. But before we do so, tell our audience who you are, what you do, mission of the business.
I work at EmpiRx Health as the Chief Data Officer, as you mentioned, JP. What we do is we are a pharmacy benefit management company. And it's a lot of words. What do? We manage the pharmacy benefits on behalf of employer groups. Just as the Cignas and the United Healthcares and the CVSs, they manage your medical side of the healthcare business. We manage the pharmacy side of it. What we do is we go to our employees and say, we are going to help you save money, because healthcare cost has been ballooning in America like crazy. And everybody has been trying to find various solutions to control the growth. So that is what we bring to the table. As you can understand, EmpiRx Health, really, the word empirics comes from the word empirical. So we use a lot of data science and data analysis to understand where wastages operate for a client. So we take all of the clients incumbent in the claims data and we examine where wastage is happening, where can we bring efficiencies of scale and more savings to the client. But the most important point and the differentiating factor here is how do we do this without compromising on the healthcare of the members? Because of course you can reduce the medication limits of a member. You can say you're going to get this medication only 60 days, not 90 days. You can say, go and get a generic, don't get a brand. You can reduce costs in various ways, but is that helping the member person at the end of the line manage their health properly? And this is where we come in. We are a pharmacy company, pharmacy management company, but we have a whole team of clinical pharmacists, PharmDs, and everybody, PharmTechs, PharmDs, who talk to the member, they talk to the doctors, they understand medications, they understand what works, what doesn't work. And we actually have a human touch. That is, we call the members, we call their doctors, and we make sure that the member is getting adequate health coverage, along with the savings that we try to bring. So this is how we differentiate ourselves from the big boys in the premium space, namely the CVS Caremarks, the ESIs, the OptumRx. The industry specifically has worked in volume. We differentiate ourselves. We are a smaller company. We cannot compete on volume, but we will compete on quality. We will compete on quality of life for the member. We will compete on quality that we bring to the employee. And this is where we use data science as a way of understanding waste is happening, where waste is happening, and how do we eliminate that waste and make it more efficient.
Could you stay on that topic? Because look, your role has evolved since joining over 5 years ago. As the chief data officer now, you're responsible for the entire data strategy. You mentioned there that data science is working to help save money. Talk to us about some of the data science at play here, how it's been so successful, and if there's a recent example that you could share about a company or a project where you and the data team worked on it. What was the objective? What did you guys have to do? And then what was the overall outcome in time or dollars saved?
When I joined the company, I actually came in as a chief technology officer over here and built out the whole technology workbench. And that has helped me now to further fine tune how do we do our analytics here? Because data analytics is what produces actionable insights to our business. I'll give you one classic example where we look at the medication prices going up. There is inflation which happens nearly every year, which raises the cost of the medications to our members, right? And particularly specialty drugs, people with very rare diseases, specialty drugs can cost in the tens of thousands of dollars. So how do we look at this problem and solve this via using data science? So what we did is we looked at where all the specialty medication spend that we had. And in the industry, we measure this by a certain factor called PMPM, per member per month. What is it that we are spending, right? That's the lowest common denominator of the spend. And when they looked at why PMPM is rising, so the spend is rising, of course, that's a very obvious answer. It's rising because inflation, maybe. But then we noticed another point that after COVID happened in between. There was a whole different problem case that we had to solve for, which was making sure that our members are able to get the COVID vaccines in time. But after that, we saw PMPM still rising. And this was because many of the members who had deferred their treatment at the COVID times, they would not go to the doctors or hospitals or the pharmacies because nobody wanted to get out. We're now going out and getting the medications that they wanted, that they needed. And not only that, there are seasonal variants of the offer where members would get medication for a 90-day renewal. And you would see suddenly your PMPM go up. So this was problem we only could understand if we looked at it, of course, after it happened, which didn't help us. This is where the analytical team over here at EmpiRx Health and the data science scientists, they came together and we said, let's look at this in a holistic manner and to use machine learning to look at the entire book of business, our entire book of business claims, which is very substantial set of claims, and see how does it go up and how does it react to various other parameters apart from what we know. So we know what we know. We looked at all the other signals that may be there, and this is where we came up with a predictive PMPM. Each month, we would publish this PMPM to our clinical team, and they would be able to get certain signals, right? And remove the noise from all the other things that are happening and see where it is going. And that really gave them a very good sense of what do they need to do, what do they need to remediate for each member. The other thing that we applied is population health strategy. So the PBM, in the PBM world, population health has not been a big thing. And even if it has been very disease-centric, where companies would specialize in certain diseases, diabetes or heart conditions, and they would only address that particular disease. But if you look at a real human being, and I'll take myself as an example, while I'm lucky I don't have diabetes and heart disease, I have plethora of other conditions, minor probably, but still, it's not never just one condition that I suffer from, or that is particularly a serious member suffers from, right? When you're hospitalized for one condition, but probably it's comorbidities, several comorbidities that came into play, which resulted in the situation that you had to go to a hospital. So we looked at this whole health approach, a member 360, as we call it, using data science, where we looked at, even though we are a pharmacy benefit manager, we are actually looking at the medical side of the picture as well for the member. We are looking at where possible social determinants of health, economic conditions matter a lot. The zip code where you live matters a lot. So we look at whatever signals we get of a member and we identify risk. And the way we do this is the most exciting part, is we use actually Johns Hopkins ECG method of risk scoring each member. And on top of that, on top of ECG, we use our predictive model to say, how is this risk score going to go over time? Is it going to go up? Is it going to go down? Is it going to be stable? And this is how the clinical team can now address these high-risk members. I'll give an important statistic over here, which is very pertinent. The top 5% of the US population account for actually the top 70% of spend, something around that. So that tells you that a lot of spend is happening with these high-risk members. And the sooner proactively you address it, the better control you'll be able to bring to this equation. You have to stop the member from being admitted into the hospital. You have to stop the member from getting to that situation. And data plays a very important aspect, because when you're working with such volumes, you have to look at the data science behind it. So we use a lot of machine learning over here, as I said, across the pharmacy, across the medical data, and social determinants of health.
You are listening to the Alldus podcast. When you're looking to scale your team, or if you are interested in showcasing your company in a future episode, reach out today. Or if you're in the market for a new role, visit our website to view open positions, www.alldus.com.
Nilanjan, I want to spend some time now talking about the team that you've assembled. You're referencing data science a lot, which tells me that you have a team of not just data scientists, you need data engineers also. And you described the organization that you're overseeing from the overall size of various headcount, the different positions that exist, and the overall culture. What would it be like for somebody working as part of your data team?
When I came into the company as a chief technology officer, we built up our data engineering section over here. And I'm still responsible for the engineering. Along the way, I am now responsible for the analytics as well. And quite frankly, data engineering, data orchestration, and data science and data analytics are joined at the hip, right? And this is where we have created team. I've got like a team of 9 people, with 5 on the data engineering side and the rest on the analytics side. We've got 2 data scientists who work exclusively on the operational data science, operational aspect of data science. The way we do analytics in our organization is that we have a strategic analytics versus the operational analytics. The strategic analytics really is more about answering questions that our clients have as to, hey, how is my plan performing? Or how are my risk score, high risk score members performing? And this is where we use the data to be able to get deeper insights into what is actually happening with that particular member or with a group of members, or what is happening in your plan. What are your risk metrics? And how do we, if this is your risk that you see being involved in going up, or your financial risk going up, what are the solutions that we can bring to the table? And we have a plethora of clinical solutions that we use to be able to address this risk.
Mm-hmm.
And on the other side, the operational analytics is more about creating the whole chassis for data science and machine learning to work effectively across our entire book of business. And this is where we use data science. We have been taking small steps very deliberately because, again, we are very careful about speed in data science and machine learning. We do not want to use AI in the mix and get some signals, misinterpret them. Because remember, at the end of the day, you have to be very careful. There is a person at the end of the line who is affected by that wrong information. So we test, we retest, we experiment, we re-experiment to make sure that what the machine learning or the AI is telling us is indeed validated. So it is a very white box approach to AI that we take, right? And we make sure that we are really generating actionable insights and not just insights for the sake of insights.
Yeah, so important. Nilanjan, I want to spend the last part of our conversation talking about what's next for EmpiRx. You and I were talking about it off air. I know when you look at the growth of the company today, you guys have accomplished a lot. But when you look at the next chapter, particularly the next 2 years, what are some of the things that you're most excited about to work on as a business? What are you excited about for the growth of the company? And what milestones are you working towards over the next 2 years?
That's the most important, interesting place that we are at. EmpiRx Health has put on the big boy plans, so to speak, right? We don't call ourselves a startup, even though we still have the startup DNA in us. We started around 8 years back as a company. Yeah, now we are multiple times of the size that we were then. We are growing at a very fast pace, right? And one of the most important things that I want to make sure is that we are able to drive business velocity and create scale as we go forward in our growth strategy. What do we mean by that? We are bringing on different types of clientele now, bigger clients from across different industries. While we were originally more focused on the small and medium-sized business, we are now looking at larger clients. And we want to make sure we are able to offer the right kind of solution. So we are really customizing our solutions based on the size of the client or the industry that they are in. And quite frankly, the industry kind of determines what kind of risk factors are at play with the population over there. If you take a client who's in the auto industry, you would get a certain set of problems, which is totally different from, say, if you went to a company which is more in the software industry and your member base are going to have entirely different set of problems. So we have to be very cognizant of who are we serving? What type of client is this? I'll give you a very good example over here. We have started offering up a program called pharmacogenomics, where we are saying we will offer this program to you because we see that your member base could actually use this in a very effective way where generally we would always do drug-to-drug interaction, how it adversely affects somebody. We are now saying we can even go further and give you drug-to-gene interaction. Is it really going to be, is this high-cost medication really going to be beneficial for that member or not? So that particularly applies in very specialty medications and high-cost medications. It is not for the general population goods. But so what we're saying is, what we will do drug-to-gene interaction tests, and we offer this test as part of this program, free of cost to the member, of course. The member doesn't pay a single dime of this, but they can now really understand whether this medication, it costs tens of thousands, right? Sometimes even more. You want to make sure that this medication is really effective for you before you spend that much. And that is a kind of program that we are bringing to our clients. This is some place where we are differentiating ourselves. And here is where we are looking for ramping up our analytics and our data science discipline. We want to be able to now go a step beyond and say, we want to do drug-to-gene interactions of blood. We want to see how a member is probably taking two different drugs, how they interact, but we also want to see how they interact with your genetic composition. And this is where a lot of AI comes into play. We are taking very small, deliberate steps in growing the team towards this program. It's an exciting place to be, quite frankly, where, as we grow up, we want to ensure that we are able to bring these different services in a value-driven approach. We quantify our success, not by, hey, how many clients did we bring, but what is the value that we actually created to the clients and to our members.
Nilanjan, final question from me then, staying on the topic of growing towards this and growing the team. You obviously play a pivotal role in not just shaping the strategy of the data organization, but managing, leading, and hiring individuals to join the team. When you're speaking to candidates, particularly for positions within the data organization, when you're speaking to candidates about EmpiRx Health, what is it that you tell them that gets them excited enough to join EmpiRx over some of the other great companies hiring?
When I talk to the candidates, when I have the interviews, one of the first things that I want to, I look for is curiosity. Opinion is not the most sexy business in people's minds. It is not, right? But I've been here 5+ years. Other members of the team have been working over here for a long time. How do we really, what makes us tick, right? That's the important question. And that's what I look for in candidates as well. And I tell them, how curious are you about the problems, the underlying problems? And how are you looking to solve this? Do you understand the whys of the problem? The business is not just to do this. Why? I think one of the most important things is to understand the why. In healthcare, in pharmacy care, it is very important that you understand the why. The curiosity matters a lot. That is something that I look for. And of course, we are looking for people who have very advanced data science skills where we can really ramp up our data science discipline. I know there's a lot of interest in generative AI these days, right? Particularly what with ChatGPT and all that. While I'm very careful about treading down that path. First of all, privacy is a very important context in which we work. But I want to be able to also see how can we apply generative AI across our data. We have got a huge volume of data. Can we apply certain systems on that? For example, Databricks, on which we work, has a model called Dolly, which can be used for commercial purposes, unlike OpenAI, of course. And we want to see whether we can create models like that to be able to apply generative AI on our data. So these are interesting areas where we are looking to advance.
Nilanjan, thank you so much for coming on today and talking to us. It was a pleasure to learn about your own background, your journey, and how you made the industry switch so successfully into healthcare. What you're doing at EmpiRx Health is very impactful. It's an interesting space for sure. It's a great use of AI and data science to impact healthcare providers on the pharmacy side, but ultimately the end users who are patients, who are people receiving treatment. So we wish you, the team, and everyone at EmpiRx Health the best of luck in months and years to come. And we look forward to having you back on the show again in the near future.
Thank you, JP. It's my pleasure. Absolutely.
Thanks for listening to this episode of the Alldus podcast. If you enjoyed today's episode, don't forget to subscribe, rate, and review. We are available on Apple Podcasts, Spotify, and any Android podcast of choice. You can also head over to our website, www.alldus.com, to listen to more podcasts, view our open roles, and stay up to date with industry news. Thanks for listening, and stay tuned for more great episodes coming very soon.